Good morning. I want to welcome you to our press briefing with updates on COVID-19. As of this morning, we've lost over 160 citizens in our community. Please join me in a moment of silence for the lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders. And first, we'll hear from City of Albany Mayor Pro Tem, Mr. John Howard. Mr. Howard?
Good morning. Unfortunately, our mayor is out of town, so he decided to let me come and just give a quick overview. But I really don't have too much to say. The only thing I do have some concern as I take my seat, I would like to ask some of the facilities when there's a slotted time for question and answer, and we're going to get right to the thick of it. Not as a elected official as of now, but as a concerned citizen in this community, there are several issues that I'm concerned about during this COVID-19 pandemic that is hitting the world. But to bring it down to a local level, there are some things that I would like to, since I see the chairman of the county administration, that there's a lawsuit that is pending with the governor and the elected officials of the mayor of Atlanta. And it said that want to make sure that masks are worn out in the public. And so I would like to, when Mr. Chris Cohel's administration of the county come up, can there be an executive order or resolution joint with the city and the county to mandate that citizen in this community, once they leave home, that he or she have to wear a mask. And the reason why I'm concerned about that, because we have a lot of individuals in this community, maybe a lot of young folks or folks my age don't believe that this coronavirus is a deadly disease. And several months ago, if you were aware, that Albany was one of the hot spots that made news worldwide. And another one I would have is that when we have someone from the law enforcement come here, is that since clubs and bars are open back up, can there be some type of gathering or looking at sightseeing that when it's difficult to maintain social distance within a club or bar because individuals are within a close proximity. And the last one I would have would be to Dr. Kitchen, which each morning I Google the coronavirus from the state of Georgia on public health, and it talks about the number, but I think sometimes the numbers may lag behind what the coroner report and what Dr. Kitchen and Phoebe elaborate on. But one of the concerns I have is that I know that there are individuals that have been admitted to Phoebe, and some unfortunately before they get out the ER, that they die in the emergency room. And my question to Dr. Kitchen would be, if a person died in the emergency room, are they being tested for the coronavirus? Because I think that's something that this community need to be aware of and informed on. And to our coroner, Mr. Fowler, as you come and give your presentation, and I'm pretty sure you have it broke down, the demographic per area, per location, and the number of individuals that have died from the coronavirus. I think that is a pressing number. We certainly need to be aware that the area, the location, and I'm not going to take away from your presentation, but I can rest assured that if we have 167, most of those probably is confined to the zip code 31705, which is East Albany, and the zip code 31701, that's anything east of Slappy. So we certainly need to make sure that we continue to educate, inform, and engage this community that this pandemic is here, and it may be number of months, probably years before it decides to go back into the ocean. But the pandemic is out of the genie box, and we got to make sure that we protect our senior citizens, we protect each other. And I'm a little concerned that school will be opening up next month, and I know there will be a lot of individuals and that will be transferring to the schools, things of that nature. So we certainly got to make sure that Albany, Dougherty County, Southwest Georgia is safe for the next generation. Thank you.
Thank you, Mayor Pro Tem Howard. We do not have law enforcement scheduled today, but certainly will pass your question on to law enforcement officials for a response. Next up, we'd like to bring up now Dougherty County Commission Chair, Mr. Christopher Coelis.
Thank you, Chief. Thank you, Mayor Pro Tem Howard. Today, as I stand before you, we are experiencing what the rest of the world is experiencing, the rest of what the rest of the nation is experiencing, the rest of the state is experiencing, but at different degrees. We all sat here 4 months ago, and we were in an apocalyptic state, where literally it felt like the sky was falling. We were hearing these tremendous numbers of people that were passing away. We were struggling to work with the National Guard, the governor's office, to get masks, to get resources, to get doctors, physicians, nurses, people to come in and address the problems that we have. And we quickly and swiftly took action. We took swift action, decisive action, and we were able to roll the numbers back significantly. We were also able to put into place certain protections that would mitigate the growth of the virus. But we knew above and beyond all of those different actions that we've taken, that mathematically, that scientifically, this was absolutely going to occur, that there was going to be a secondary bounce, that whether you call it a rebound, whether you call it a secondary spike, whatever words people want to call it, this was going to happen. And I'm very proud of the fact that in our community, it has been mitigated, that we have had the resources that we have had, that we have had the education that we have had. And I'm very thankful for that, but I'm also cautious. And we are seeing a secondary spike in our community. Is it anywhere near what we saw in March? No. Anywhere near what we saw in April? No. But we are seeing a rise in numbers. Does that make sense? Absolutely. Why does it make sense? Because we've gone back to business and opened up so many different businesses, so many different outlets for people to congregate, to connect with each other as part of just the normal human experience. And though we're doing it in different ways, the virus is still going to get spread. Are the death numbers still much lower than they ever were? Yes. Have they started to rise? Also, yes, they have. Is this a time where we need to continue to have caution? Absolutely. And I want to caution people. It's almost like I get the feeling from some people that it's almost like the person who goes on a crash diet. And they lose about 5, 10, 15 pounds. And then suddenly they think, oh my God, I can fit into, that pair of pants or that dress. And now I can do whatever I want to now that I got into my dress or I got into my pants for this one event. I can go back to business as usual. Let me be very crystal clear. Our way of doing life for an undetermined amount of time is forever changed. That's just a fact of the matter. If you go online, you watch, other health experts from around the world. I watched, a couple of months ago as the Prime Minister for Singapore was talking about literally what their plans centered around in Singapore and how they were going to address this virus on a forward-moving basis, and their plans are, for 24, 36 months out. I don't know if a vaccine is coming. What I do know is this: our habits have to change. Our habits have to continue to be developed. And if we think about what we've been doing, we have established so many good habits in this community that, frankly, most other communities around the state have not had the opportunity to establish, because they didn't experience the onslaught that we did at the very beginning of this entire pandemic. We had to learn. We were tried by fire. We had to learn all of these different things. And frankly, and I'll express this: I recognize that some other cities around the state have tried different things, and they tried to mandate that people do certain things. I'm not interested in mandating that every single citizen, in every single encounter, in every single step that they take outside of their home, whether an infant or a 65-year-old grandmother, has to wear a mask. I don't think that that is effective. I frankly think we're more effective in voluntarily getting people to do the right thing. I think we're more effective in encouraging our businesses to require that people coming into their stores wear masks. And I want to paint a picture for you, because I know there's a lot of political debate about this, whether or not you should or you shouldn't mandate masks. Well, I'll say this. One, does anyone tell us what we have to wear when we get up in the morning and go to work? Does the government tell you what to do when you want to go into to a restaurant? What do you have to wear? No. We know from the Department of Public Health that many people have overcome the virus. In fact, thousands of people in this community have overcome the virus. And we know from the Department of Public Health that that there's no credible evidence that any of those persons within the past 6 months has been reinfected. Highly suggestive that there is some degree of immunity. Does that mean that we have to require every person that has immunity to wear a mask? Does it mean we have to require a person that's riding their bicycle down the road or on a trail totally secluded from everyone, or a man that's fishing on the Flint River by himself from wearing a mask? Do we have to mandate that he wear a mask at all times? Now, I'm sure that there are discussions that can be had that are short of that type of mandate. But what I will say is this: I think our energy is, and I'm a huge proponent of masks. They are effective. I've advocated for masks. I've asked the state to give us more masks. We've compiled over 200,000 masks in this community. They are effective. Churches require all of your parishioners to wear masks when they come in. Restaurants, make sure that all of your waiters and wait staff and cook staff are wearing masks. Walmart, I see, has required everybody as a condition of coming into their store to wear a mask. I think that's the more appropriate way to deal with these types of things. And I think you're also going to see a more comprehensive and precise plan in addressing these issues that centers around gaining voluntary participation as opposed to beating everyone over the head and requiring and mandating that as soon as they walk out the door that they have to wear one at all times. We know that there are exceptions, and frankly, we also live in a free society, and that's how I believe it. And I also think that if you have a policy, you have to be able to police the policy. And I think it's unrealistic to expect that we're going to have teams and teams of police officers that are willing to tackle people that are either floating down the Flint or riding a bike down a trail by themselves in order to spot check these issues. I think what we have to do, though, is build a culture of masking up Albany and also just doing the things that are right. And we've been very effective at that. However, right now our numbers are rising. Are they apocalyptic? No. Are they absolutely devastating? No. Are they consistent with what is going on around the state and the nation? Yes. Do we have a tremendous number of resources to address these issues? Absolutely. Are we blessed to have tremendous healthcare workers that are continuing to work very hard, but that are also seeing the number of hospitalized patients rise? Yes. We need to be conscientious of these facts. I suspect that around July 4th, a lot of folks got together, probably didn't wear masks, probably spent a lot of time with family, probably congregated with friends, and you know what? The virus probably proliferated a fair amount in this community. And I'm thankful for the fact that we haven't had a large number of fatalities, but any fatality is too much. And we really have got to focus our minds on changing our habits. Stick a mask on your rearview mirror when you get in the car. Have an extra one in your glove compartment. Put one in your purse. Make it part of your routine. That just as some ladies check their purse or some men check for their wallet, when you get out of your car, put on your mask. That's helpful, because if we do that, and this has been also my experience, if you tell someone that they have to do something, they often resent you and they want to fight you. But if you show them that it's the right thing for the right reasons at the right time, and you gain their voluntary consent, they'll be your biggest proponent and your biggest asset. Thank you.
Thank you, Mr. Chairman, for your comments today. Now we will hear from our representative from Phoebe Putney Memorial Hospital. The Chief Medical Officer for Phoebe Putney is here, Dr. Stephen Kitchen.
Thanks, Chief. And yeah, I was just reflecting on the fact, I think the last time I stood before you on this podium was probably almost 2 months ago. And with the resumption of the press conferences, I just wanted to kind of attempt to give you an appraisal of where we were then, where we are now, and probably more importantly, what we anticipate on a go-forward basis at this point. So, you know, as a reminder, when the thrust of COVID was truly in the midst of our community in mid-March and April, and I think we all appreciate the fact that our community and our hospitals locally were just inundated with COVID-19 patients at that time. We roughly had a census of 160 COVID patients in the Phoebe facilities, and of that 160, probably about 50 were in the ICU requiring ICU care at that time. Fortunately, we really saw those numbers decline significantly in the latter part of April and throughout the month of May, and basically we hit our nadir in terms of the number of hospitalized patients we had probably late May and well into June, which is really about 30 COVID patients at Phoebe, Maine, and concordantly, we saw the number of daily admissions of patients with COVID-19 drop precipitously, well down into single digits, and we would typically have maybe 3 to 5 patients a day. What we're presently observing is, I think, very much reflective of what we're seeing in other communities statewide and nationally as well, in that I think it's well recognized right now the number of COVID cases on a daily basis and weekly basis are continuing to go up at this point. And we've certainly seen that statewide. We've seen it in surrounding communities such as Tifton, Valdosta, Moultrie, and so forth. And that's what we're seeing locally at Phoebe Putney in Albany, Phoebe Sumter in Americus, and Phoebe Worth in Sylvester. So from that low point in the low 30s, we have seen those numbers steadily increase over the last several weeks. And so as of this morning, what I will tell you is this. At Phoebe, Maine and Albany, we had 68 patients who were positive for COVID-19. The vast majority of those are hospitalized at the Phoebe North campus. Excuse me, 57 at Phoebe North and 11 at Phoebe, Maine. The breakdown between patients in general medical beds and ICU beds is, of those 68 patients, 47 are in a general medical bed and 21 are requiring ICU care and are in one of our ICUs. Over the last 24 hours, we've had 9 patients who required admission to the hospital with COVID-19, and we've had 5 patients who have been discharged from the hospital with COVID-19. I think there's a couple of observations at this point that I think are very noteworthy in terms of why there continues to be such widespread community transmission, not only in Albany, but across our state and nation as well. Unfortunately, this is a virus that oftentimes will that individuals who have been exposed to the virus, who are infectious and transmitting the virus to others, have little to no symptoms. And so oftentimes it's 3 to 5 days after the time that people are infected with COVID-19 before they show any symptoms at all, if they show symptoms. So what I'm saying is this virus has the propensity to be spread when people unknowingly are infected. And I think that's certainly the phenomenon that we're seeing in our community across the state and nationally as well. We're all hopeful from the standpoint of what therapies are out there. But, I'm going to be very honest with you and tell you, in terms of therapies, there's simply no silver bullet at this time. There are several medications that are being looked at, several medications that are being used in patients in what we call controlled clinical trials that have shown some value and some merit, but there is simply not a cure-all at this point. I still maintain our best hope ultimately is going to be that we'll develop a vaccine. There's over 60 potential vaccines that are being looked at this point, and there's a handful that are showing very significant promise. And hopefully we'll have the availability of a vaccine in the next 6 to 9 months. But there's 2 things that are absolutely mandatory. You have to make sure that any vaccine is safe, and you have to make sure it's effective. And it takes what we call controlled clinical trials to be able to demonstrate the safety and efficacy of any vaccine. So, where does that leave us at this point in time? I know that everyone wishes for a state of normalcy at this point, where all the measures that we put in place are no longer necessary. But my perspective is this: I think we can truly go on and lead our lives. I do. We have learned a lot. Our understanding of this virus continues to evolve. But what we know is that if collectively we take some measures which are socially responsible, which is wearing a mask in public, maintaining social distancing of 6 feet or more, being very vigilant with hand washing and hand hygiene, and simply not congregating in large crowds. We certainly flattened the curve before. We're fully capable of doing that again. But I do think we just need to accept the fact that this is a virus that's going to continue to be with us for a while. So those are the thoughts I have to share at this point, and I continue to thank everyone for their efforts and all the things that together we have done that have certainly not put us in the same state that we were before. So thank you.
And thank you, Dr. Kitchens. Now we will hear updates from Dougherty County Coroner, Mr. Michael Fowler.
Good morning. I was hoping this day didn't come back, that we have to start a press conference again, that we have to give counts and numbers again. But I see we have came to that point again. My heart and prayers goes out to the families that have been affected by this virus. I'm gonna go through some of the stats that we have now that's going on, and a couple other announcements I'm gonna make at the end of the presentation. At this present time, we have 167 positive deaths here in Dougherty County that was reported to us. There have been 17 deaths reported in the past 4 to 6 days. These are the breakdowns of the location of death in Dougherty County. 31721, we had 20 deaths. 31707, we have 33 deaths. 31705 on the east side, we have 36 deaths. On the south side, southwest side, we have on 31701, we have 78 deaths in the south side. Total, we have 97 females, we have 70 males. We have one Latino, a breakdown of it by race, one Latino. We have 34 whites, we have 132 blacks. The breakdown of that, we have one Latino male, we have 24 white females, we have 10 white males, we have 71 black females, and we have 60 black males. That's a breakdown of it. By age, we have 2 in the age of 20, 3 in the age of 30, 11 in the age of 40, 10 in the age of 50. We have 47 in the age of 60. We have 44 in the age of 70. We have 34 in the age of 80, 15 in the age of 90. And we have 1 that was over 100. You know, we started back in March. This is a breakdown of the death that we had, and the most deaths we was having back in March and April. You can see the ratio of death that we're having. The deaths have definitely declined compared to what it was months ago. Definitely have. A breakdown from June, the first week of June, from the 1st through the 6th, we had 1 death. June the 7th through the 13th, we had 1 death. June the 14th through the 20th, we had 3 deaths. The week of June the 21st through the 7th, we had 0 deaths that week. June the 28th through the 4th of July, we had 1 death. July the 5th through the 11th, we had 4 deaths. July the 12th through the 18th, we had 2 deaths. July the 19th through the 25th, we had 4 deaths. And July the 26th to August the 1st right now, we had 1 death. Breakdown by months, you can see the number of deaths. Back in March, we had 38 deaths. In April, we had 86 deaths. In May, we had 26 deaths. The month of June was our lowest month. We had 6 deaths related to COVID-19. Of July, we have 11 deaths. This is a disclaimer that I'm going to put out. For the last 3 weeks, people that died in the past in the ER was not tested. I requested that they be swabbed and tested, but I thought they was being tested because I have family members calling me all the time, want to know what's their loved one tested positive, so they need to know whether to go in quarantine or what do we need to go get tested. So, and I had families on hold, and I'm a straightforward person, waiting to give them answers. Then eventually I found out that people was instructed not to test any other death that died in the ER. So for the last 3 weeks, I would not get any reports from Phoebe. Department of Public Health did not get any that died in the ER. So, however, since this week I got a chance to talk to Dr. Ruiz and also the Department of Public Health, we're going to try to get the patient tested. We may have to pick them up from Phoebe and carry them to the Department of Public Health or somewhere to get them tested from the ER. But most of our death was happening in the hospital prior to this time. A nursing home patient was dying, definitely a resident was dying, but most of our patients was coming through the ER. We were getting a lot of those deaths from the IC unit. So since that time, like I said, for the last 3 weeks, we have not gotten any reports, and I found out that they are not doing any more testing for the ER. And I think it's very important for them to test because, as Dr. Kitchen said earlier, sometimes they don't even show signs. So only thing that we're going to have to go on now when we get to the Department of Public Health is the family member said he had some symptoms, some signs. We can't take everyone from the ER to get tested, but the simple way we were doing it, the people was testing all of them. So that's not happening now. So I'm putting a disclaimer out that we have 167 positive deaths that were reported, possible more since the 3 weeks that we did not get those reports. I want to say too, kids getting ready to go to school is very important. It's a good thing to do. Parents now practice with your kids wearing masks. All masks don't fit properly on you. And some feel uncomfortable, some feel like you're smothering yourself. So find a mask that you can practice with your kids before school even starts, that feel comfortable to them, that they can keep on all day at school. So then I've talked to some family member, they said, well, I've tested negative, so I don't wear a mask. Well, you can test negative today and walk around someone else tomorrow and be positive tomorrow. A lot of time we feel, well, I'm negative, so I don't have to wear it around my family or kids. I can go out, I'm okay. But you still can receive the virus by being around someone else. Things going into the churches, a lot of churches was asking, I have a lot of churches calling me, asking me questions. I'm a pastor myself, and one of the things that I do, we haven't had any death or either any sick in our church so far that come to our church. And some of the things that I do, I'm trying to give you some things that you could do, is wear a mask. And wearing a mask, you cannot wear a mask just on your nose or just on your mouth. If you're wearing it just on your mouth, you still can inhale the virus through your nose, so nostrils. So you got to have it on your mouth and your nose. So that's one of the things that we do. We spray shoes before we go into the church. We take temperature checks when they come in. We provide hand gel, and we practice social distance. We tell the members, if you're sick, stay home. You, wear gloves if you count money. Good thing to do is use the apps, Giveify, different Cash App, different things like that. And you can have also multiple services. A lot of times, different individuals may not think about it, but you have the public going back and forth into your bathroom at church. So every 15 minutes, we have our bathroom clean. And the door knobs washed, the knobs, what you cut the water on, whopped off. And after every service, the church refog the church. And that's a good thing to fog and to sanitize your church. Do not hug, do not touch, and you got to be safe. But again, like I said, we've come a long way, as Dr. Ruiz and the chairman and the mayor pro tem have said. But like I said, you got to mask up. You got to mask up. I know it might feel uncomfortable, but you got to mask up. I want to encourage you to mask up. Thank you.
Thank you, Coroner Fowler, for your report. We will now receive an update from Dougherty County School System. Ms. Lakeisha Bryant-Bruce, the Director of Community Relations, is here for the report.
On behalf of Superintendent Kenneth Dyer and our board members, I just want to take this time to share another update from the Dougherty County School System. On Wednesday, the Dougherty County Board of Education formally adopted what we had already been previously communicating, that all of our students will begin school in the online instructional model. There will be no students returning to on-campus instruction at this time. We made this announcement on July 20th, but I want to repeat that it has now been formally adopted and all students will begin school in the online instructional model. We will use rolling start dates. Those dates are high school students, grades 9 through 12, will begin August 17th. Middle school students, grades 6 through 8, will begin August 24th. Elementary students, grades pre-K through 5, will begin on August 31st. Students will need a device in order to participate in the online instructional model. Our online instructional model this fall is vastly different from the online model that we had to implement when we did our immediate shutdown back in the spring. So students will need a device in order to participate in their instruction. The school district will provide a computer device for any student that does not have a device in the home that supports online instruction. Pre-K through 2nd grade students will use iPads, and 3rd through 12th grade students will use Chromebooks. In addition, we have approximately 5,000 Wi-Fi hotspots for households that do not have reliable internet access. And when we say reliable internet access, this does not include a hotspot on your cell phone. Our device distribution will begin next week. We will start first with our high school students, grades 9 through 12. Their distribution will be August 3rd through the 7th. Middle school students, grades 6 through 8, their distribution time is August 10th through the 14th. And elementary students, grades pre-K through 5, distribution is August 17th through the 21st. All devices will be distributed in a drive-through fashion. You will not be able to enter the buildings. Parents will remain in their vehicles. We also ask that as school administrators are approaching your vehicles to have conversations with you and get the appropriate documentation, please have on your mask or one will be provided for you. You can find the schedule for device distribution on our website, going to our main homepage, and you can also find this information on our social media sites. Our open house activities will be conducted in the safest and most efficient way possible. So this year, open house will take place virtually. We are giving priority to students in transitional grades, pre-K, kindergarten, 6th grade, and 9th grade, along with students that are new to the Dougherty County School District. Those students will have an opportunity to engage with their teachers and administrators in an open house small session by appointment only. Information on how to make these appointments will be available early next week. The dates for open house are the week after device distribution. During that time, we will also have student orientations and technical support time for teachers and students and parents to become comfortable with the online instructional model. Meal distribution will restart next week, Monday, August 3rd. Meals will be delivered on Mondays and Wednesdays, with breakfast and lunch for each day. No weekend meals will be served. The routes for distribution are based on high school cluster, and we have shared the details on bus stop locations and times on our website and on our social media pages. Please wear your mask while waiting at the bus stop and practice social distancing. We also encourage all parents and guardians of students in the district to make sure you have updated your contact information in our parent portal, better known as Infinite Campus. We use this information to send important communication for the school year, and your contact information in this portal will be how teachers communicate with you regarding open house appointments, student orientations, and your child's academic progress. You can find the portal on our website, click the Resources tab at the top of the page, and then click DCSS Parent Portal. There are videos and steps to guide you through the process of creating your account or resetting your password if you already have an account in place. If you have any questions about our Responsible Restart Plan, most of your answers can be found on our website, www.docoschools.org. Again, we all have a collective responsibility to help slow the spread of COVID-19 here in our community, and the Dougherty County School System encourages you, please wear your mask when you're out in public. Wash and sanitize your hands frequently. Avoid crowds and practice social distancing. Let's each do our part so that we can help get COVID-19 under control here in Dougherty County. Thank you.
Thank you, Ms. Bruce, for that update. We will now have an update from our Emergency Medical Services team, the Director, Sam Allen, Dougherty County EMS. Mr. Allen.
Good afternoon. I'm the final presenter today, and I want everybody to stop and think for a minute what you've heard Commissioner Howard, Commissioner Cohilas, Dr. Kitchens, Coroner Fowler, Chief Scott, Ms. Lakeisha Bryce from Dougherty County Schools. Everybody has talked about masks. Masks are vitally important to our community. We need to wear the mask as much as possible. So as we move forward, the CDC has a guideline out now recommending the proper use of masks. We see a lot of people around town that are wearing masks that it's not doing them any good. It's not doing the person any good. It's not doing anybody else any good around them. So as you can see on the slide, the correct method of the mask is to properly put it on, wash your hands before you put it on, use hand sanitizer as you're getting ready to put your mask on. Put it on so that it fully covers your mouth and your nose. A lot of people are wearing masks and they're putting the mask below their nose. They say it's uncomfortable, it fogs my glasses up. Think about this. You're leaving your nose exposed. Where's the first place that you get the coronavirus test? They test your nose. So please wear the mask properly as we go along through the virus. When wearing a mask, please do not do the following. If you need to take the mask off, put it hanging around your neck while you're out shopping in stores or activities. Please keep it away from your neck. When you put the mask on, make sure that you properly put it around your ears, the correct method. Another thing is don't allow, if you have the kind that has the straps that go all the way around, just don't use one strap. Use both straps. It gives you a good, better seal. Don't touch and adjust your mask. Once you get it on, if you have to, pull it from the sides. Make the adjustments there. Try not to touch the middle area. Stay away from that. Don't wear your face mask as a hat. We pulled up on a scene at a house the other day and 2 people had masks on as sunbonnets. Please don't wear them like that. They're not designed for that. They're designed to be worn to cover the mouth and the nose completely. Another thing is don't wear a face mask and have it hanging on your arm as a matter of convenience. If you have to take it off, put it up. Keep it as less chance of being exposed. Again, we're all in this together. As we go through the virus, we are seeing some numbers slightly increasing since the beginning of July. We got the numbers down in the community. Everybody did a great job. Let's all pull together. Let's help get these numbers back down, and let's do it by good hand washing techniques and by properly wearing a mask. Thank you. Thank you.
Mr. Allen, thank you for your report. You mentioned mask wearing. I've been asked, why do I leave my mask on continuously throughout our presentation? And we know that taking your mask on and off is not good. And so I leave mine on because I'm continuously back and forth from the podium. So That is why I leave mine on during the entirety of our press conference. We will stop now. We'll pause here to open the floor for any questions at this time. Yes. Please, if you'll make your way to the microphone.
So, for Dr. Kitchen, how many people are on ventilators right now, and what does ICU care entail? I know I spoke to Dr. Black not too long ago, and he was saying that he was seeing more GI symptoms. Are we still having lung issues, or what does ICU care entail?
Dr. Kitchen, if you make your way back to the podium.
Again, out of the 68 patients that are currently hospitalized at Phoebe Putney with COVID, there are 21 that are requiring ICU care. And patients can be admitted to the intensive care unit for a variety of reasons. Sometimes it may be because they're having a significant heart issue. Other times it may be because they have a life-threatening infection. Other times it may be because they're having, significant respiratory problems with breathing and that sort of thing. What I can tell you is this: almost exclusively for patients with COVID-19 that are requiring admission to the intensive care unit, it's because they are having significant respiratory difficulty. Their oxygen concentrations are usually dangerously low, and they're requiring intensive therapy, which may include putting that patient on a mechanical ventilator to support them. So, like I said, there can be a variety of reasons that patients are admitted to the intensive care unit, but what I will tell you with patients with COVID-19, it's almost exclusively because they're having what we call respiratory failure, and they're simply not able to sustain oxygen levels that are sufficient without placing them in the ICU. We have, let me see, across our ICUs, there are a total of 47 patients. That includes both COVID patients that are positive for COVID-19 and patients who do not have COVID-19 who are admitted to the ICU for some other reason. Of that 47, I think 21 are currently on a ventilator. What I would tell you, that's a very dynamic number. I mean, it can change. Certainly will change within the course of the day. May change within an hour or two, as we typically are patients who are showing improvement, wean them off. There may be other patients whose condition is deteriorating and they may require to be put on a ventilator. But again, there were, out of the 47 patients in the ICU, I think there were 21 this morning who were on who were requiring mechanical ventilation.
And then since I have you up here, can you maybe speak, I don't know if you can, but can you maybe speak to what the coroner said about testing ER deaths?
Well, I will tell you this. I respectfully, but I also categorically disagree with what Coroner Fowler has said. And I'm going to tell you, it's simply a gross misrepresentation of the facts. The facts are this: Phoebe Putney tests every patient who is admitted for COVID-19. We do not test every patient who may come to the emergency room and be discharged. However, if a patient is brought to Phoebe Putney and they have expired in the field and they are not registered as a patient, we do not do a COVID-19 test on that patient. That patient is under the responsibility of the coroner until the remains are released. I'm going to tell you this. Phoebe Putney was one of the first hospitals in Georgia, if not the first, to elect to test every patient who is admitted to the hospital, regardless of whether they have symptoms of COVID-19 or not. That has been our policy since about mid-March. And if we had infinite testing capabilities, we might be able to test every patient who came into the emergency room and is discharged. The reality is there's a limited number of testing kits that are available. We receive an allotment every week. We just went to extraordinary means to bring on another test to expand our capability for COVID-19 testing. The Department of Public Health, and I certainly applaud them for this, decided they wanted to take a very proactive stance and offer testing to the community at large. And that testing is available. Again, I'm just going to go on record to say that's simply a gross misrepresentation of the facts.
I have one more question.
Please,
I'm
go
sorry.
right ahead, yes.
Okay, so Chairman mentioned habits have to change. When I see the zip code chart, you know, it makes me wonder why people might have a higher chance of dying in a certain zip code. What habits are we seeing in these zip codes that might make them more prone to having a COVID-19 death?
I think it'd be appropriate to bring the coroner back up. Mr. Fowler can certainly speak to information he's found in the various zip codes. Mr. Fowler?
Why might certain zip codes be more prone to COVID-19 death?
Well, I think there are going to be a number of reasons. I can't pinpoint. Maybe it could be economic. Maybe because it might not have the means of getting to health benefit and health attention that they really need. A lot of time they stay too long at home, don't want to go because they don't have the insurance or they don't have transportation, economic. It could be finance. It could be a number of things why the death rate is higher in certain locations. So I can't pinpoint it, but I know it could be a number of reasons.
Okay. Thank you. I'll go sit down.
Yes, Mayor Pro Tem.
I want to ask Dr. Kitchen to come back to the podium for a minute, Dr. Kitchen. Thanks again, Dr. Kitchen, for your update. But let me ask you a question that has been saying that don't trust politicians, but since you're a certified physician, there have been numerous infection control physicians nationwide, worldwide, and epidemiologists worldwide is saying that the importance of wearing the mask out in the public. But as a physician for a number of years, and it's hard to predict because the last time we had a huge outbreak was in the 1900s during the Spanish flu. If I were to ask you, and we don't know because it's hard to project and what will happen in the next several months, this time next year, do you think we'll still be having some symptom of this COVID-19?
You know, I think a lot is going to depend upon the availability of a of a vaccine. You know, what's unique about COVID-19 or coronavirus, and it's almost identical to what was called the Spanish flu. It's a novel virus. What that means is it's a virus that we haven't seen before. And so therefore, the ability to develop immunity against a new or novel virus simply doesn't exist. And that's why it's had such a devastating impact. So, you know, I think, take the scenario where there's not a vaccine, all right? What likely we will observe over the course of time is that people will develop immunity over time. As more people get exposed, we know there's a lot of people who have tested positive for COVID-19 who have no symptoms at all, and even those that do, and even those who are hospitalized, generally are going to develop some degree of immunity against the virus. There's a concept called herd immunity, and what that means is when the prevalence of the virus in a community, state, whatever, is enough to where a majority of people have been exposed and the majority of people develop some degree of immunity, you see the transmission rates absolutely just plummet at that point. How long that will take, I don't know. But like I said, what will really dramatically change that curve is if we have the availability of a vaccine.
And my final question, which I'm from the old school, but I'm going to wear a mask until there's a vaccine. If it's not to 5 years, I'm going to still, I have numerous of masks. But in the city of Albany, Georgia, and Dougherty County, which I'm emphasizing here, would you suggest that once he or she leave their household, that it should mask up? Because, you know, the mask has been proven by data that it will, you know, stop from the droplets that will be exposed in the community. So trying to get individuals to wear a mask and trying to educate the community, would you say that if he or she decides to leave the house, that they should have on a mask?
Yeah, my feeling is this, my position is this. I think the science is overwhelming. For this particular virus, masking is extremely effective. And, you know, my feeling is this, if you're out in public, if you're in an arena where you're gathering with anyone else, I think there's great benefit to masking. I think it protects the person, and it also protects the other person on the other end as well. You know, I think Chairman Cohilas mentioned this. If you're out by yourself, if you're taking a walk or riding a bike, or and you don't have anyone else around you, then I don't think you really need to worry about the transmission of COVID-19. But I think acknowledging the fact that we're going to be in public places every day, whether it be the grocery store or your business, or if you choose to go out to eat, and I think it's very, very important. I think masking is very important, and I do think the science is just very, very convincing that for this particular virus, it has such a propensity to be spread with respiratory droplets. Wearing a mask and maintaining social distancing can dramatically reduce the chances of transmission and becoming infected.
Okay.
We will conclude at this time our press conference for today. We will, of course, remind you that the Emergency Operations Center is open, and you may call the EOC with any questions you may have at 229-302-1900. The EOC is open 7 days a week from 8 to 5 daily. Please join us here for our next press briefing next Friday at 10 a.m. We'll see you then, and remember, mask up Albany, mask up Dougherty County. Thank you.